Hello, this is Jan Leifman from MedNews Week here live at the 2022 ASCO annual meeting. Today, as part of MedNews Week's ASCO 2022 Spotlight, we are showcasing the amazing discoveries here at this year's ASCO. Standing with me is Dr. Sophia Kamran, Assistant Professor of Radiation Oncology at Harvard Medical School and a radiation oncologist at Massachusetts General Hospital Cancer Center, who presented her abstract entitled Recent Trends of Manos and Gender Representation Amongst Panelists at the ASCO annual meeting. So, Dr. Kamran, would you mind telling us more about the study and what you discovered?
Yeah, absolutely. Happy to be here. Thank you. So basically, my team has done prior work looking at gender disparities amongst medical and radiation oncology academic faculty. And we found that although the representation of women has increased over time, particularly over 50 years, we looked at back 50 years, it has increased, but there is stagnancy at the upper echelons of academia. So essentially at the leadership levels, at the highest ranks, there is a documented stagnancy. Now, we do know invitations to speak at major national and international meetings these are used by faculty promotion and tenure committees for professional advancement. Separately, there's been a recent movement. There was a call by the NIH Director Francis Collins in 2018 to eliminate manels or all male panels at all scientific conferences. Since the ASCO annual meeting is one of the largest international oncology conferences per year, we wanted to investigate the prevalence of manels and also evaluate trends of invited panelists for 4 years, 2018 to 2021. So we looked at ASCO online programs. We looked at session faculty information. The other difference I wanted to note here is that these faculty, the invited panelists, invited discussants, et cetera, they're all invitations. So they're invitations from the leadership committees and the program planning committee. So this is different than if you were to present like a scientific abstract or things like that. That's all based on merit of the abstract, but these are specific faculty invitations. So we looked at perceived or self-reported gender, medical specialty, panel role, type of session, the topic. For 2021, we then did a deeper dive and we looked at individuals' academic position, publications, citations, H-index, et cetera. And so our primary outcome was to look at the percentage of males and the proportion of female panelists over time. And what we can see is that actually over time, there was an increase in the representation of female panelists and female chairs and moderators from 2018 to 2021, which is very encouraging, with a subsequent decrease in the percentage of proportion of males over time, which is expected. We then did a deeper dive by the session types and topics just to see if there was anything that kind of popped out from that analysis. And we did find that there were disparities that actually did not improve over time. So what we found is that there's underrepresentation of female invited speakers in the topics of genitourinary cancers and also preclinical sciences and translational sciences. And there's actually overrepresentation of invited female panelists in the topics of supportive oncology topics. And we lumped that together. That consists of geriatric oncology, patient-reported outcome data, and also like patient survivor. So those types of topics. So clearly, and that disparity is growing. So clearly there is an improvement in the percentage of proportion of males and the percentage of female panelists over time, but there is a growing disparity in certain areas. And we call on leadership to say that this is positive. We're very happy that this is moving in the right direction, but we need to increase awareness that for certain areas, we don't want to grow any disparities over time. And so maybe the program planning committees need to be a little bit more mindful so that we or at least more diverse representation, diverse voices in these different topic areas. And eventually we want to continue to evaluate this, especially after this is presented. We want to see if this improves as time goes on. And then ideally, one day we would like to look at the race and the ethnicity of panelists. So look at that type of panel representation by multiple characteristics. But that's going to be a little bit harder because that information is less available. It's, what we would like to do in the future. So this is, again, it's really important for us to be aware of this, to present this data, have leadership and planning committee just be aware of what they're doing well and then what areas we have room to grow.
Awesome. Thank you so much for that thorough presentation. We'll look forward to the follow-up study over the next few months to years. Thank you.